talking about how the concept of ECG connects to congestive heart failure. On the screen, we can see a normal ECG waveform. This occurs when the electrical signal is able to move through the body smoothly without any complications. In patients that suffer from congestive heart failure, the electrical signal gets interrupted and the timing of the electric current gets messed up. One of the most common arrhythmias in patients with CHF is atrial fibrillation. In this case, the signal between the SA node and the AV node becomes chaotic. The AV node is bombarded with impulses trying to get to the ventricles. The ventricles end up beating faster, but not as fast as the atria because not all of the signals can get through. This leads to an irregular heartbeat, and it shows on the ECG when we see uneven spacing between the QRS complexes. This is a visual representation that the signals were unable to pass through the AV node. The second most common arrhythmias appear when patients have left ventricular hypertrophy. This is caused by the thickening of the heart, which makes it harder for the heart to pump the blood. This is normally more easily caught on a clinical ECG that contains 12 leads. Leads 1, 2, 5, and 6 are used to spot the ventricular hypertrophy. This is shown through the characteristics of the QRS complex. On the top of the screen, we can see a normal ECG wave. Comparing this waveform to the waveform of left ventricular hypertrophy, we can see the depolarization of the ventricles does not occur properly. We can see that the heart requires a much bigger signal to polarize the ventricles than it would in a normal heart. We can see that the lack of septal Q wave means that the Purkinje fibers are not firing properly. The convex ST segment means that the heart is not given the proper amount of time between ventricular depolarization and repolarization. This leads to the heart not having enough time to properly repolarize. Something to note is that the QRS complex is not a reliable way to diagnose left ventricular hypertrophy. Body configuration is a large factor in this situation, along with age and gender.